What were the cases that you selected for submission?
Interestingly, I was struggling a lot with gynae cases, and I had actually no good gynae case probably 2 weeks before the exam submission. But eventually, I ended up submitting 3 of gynae. I had a very nice case on infertility. It was a telephonic conversation, and it went very smoothly. As I said, this exam is dependent a lot on the patient and, of course, how ready you are. So this was a good patient, and it was a nice flowing conversation. And I also learned during all my recordings that rapport building is very vital. I mean, if you're able to develop rapport, be it a pediatric case or an elderly, it goes a long way. In giving what the examiner wants. So I had 3 cases from women's health. One, as I said, was infertility, telephonic one. Then the other 2 were face-to-face. One was about irregular periods in a young girl. And the third one was nausea during pregnancy. Then in the acute case, I managed to get a case on acute abdomen, suspected appendicitis. In mental health, I got 2 cases. Since the place I am working, we get loads and loads of mental health. This was not difficult at all. So both these patients were young women, and they had different problems related to anxiety and depression. And their response was very different. One was willing to consider medications and other things as well, lifestyle measures and CBT. But the second one didn't want to try anything. She felt everything is no good. So that was a different challenge with her. In the elderly case, I had a lovely lady with osteoarthritis. In that case, I sort of struggled with the time that got lapsed during examination, because this lady had a lot of pain, and it was difficult for her to, sort of semi-undress, and all that bit took a lot of my time. That was a bit of a challenge in that. In the pediatric case, I managed to get eventually a child with recent croup infection, and it was a post-croup cough, and majorly needed reassurance and detailed examination. The child was very sweet and compliant, so I think the rapport building with the child was my plus in this. And the other cases, there was one case, a young man with asthma-like concerns. He was concerned about his exposure to asbestos in past. So that was one important aspect with him, and I went through the details of asthma with him. I assessed his PFR readings, and again, the patient was very good. And the time, I managed to adhere to the time thanks to the patient. Then I had a few cases related. There was an IBS case which went very well. Then there were 2 cases of palpitations, and both had different sort of presentations. They were young people, anxiety related, I guess. I took the exam in November, so I don't remember all the details, but I'll try to maximally give them important bits. So there were 2 cases on palpitations, young women, but different sort of presentations. I ruled out all possible cases, possible reasons for palpitations, and we managed to, I arranged for a follow-up with them, and ruled out any possible concerns regarding cardiovascular family history, and dealt with all that. And the last case was a telephonic consultation about abdominal symptoms. She had a chronic symptoms related to her abdomen, and she was a very irritated patient. She was initially very irritated, and eventually she felt that she's heard, and towards the end, she was a very different person altogether. I think that was the reason I managed to include this. Most of my cases were face-to-face. I think only 2 cases which I submitted were telephonic, and this was one of them.
Are you struggling with your consultation skills? Maybe you need help and you want to get constructive feedback. If you'd like to get help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you get some insights